Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. The second line, pharmaco. The second line, pharmacotherapies. So the second line, pharmacotherapies, this is in case of the smoking cessation. The second line, pharmacotherapies for the smoking cessation. So what does it include? First is the clonidine. So clonidine, the mechanism of action being the alpha adrenergic. So it is alpha adrenergic receptor agonist, and it helps to alleviate the nicotine withdrawal symptoms. So alleviate the nicotine withdrawal symptoms. Next is the dosage and administration. Is first you start with 0.1 mg. So 0.1 mg, it is twice daily. So give 0.1 mg twice daily, and then the titrate as needed. Now what are the adverse effects? The adverse effects is it can be presence of the dry mouth, there is presence of the dizziness, as well as there can be hypotension. Then comes the norethylene. The norethylene, you have the norepinephrine and the serotonin reuptake inhibitors, norepinephrine. The norepinephrine as well as the serotonin reuptake inhibitors. So you have norepinephrine and serotonin reuptake inhibitors, and it helps to reduce the nicotine withdrawal symptoms. So first is in case of clonidine, we start with 0.1 mg twice daily and then titrate as needed. Whereas here you start with 25 mg. So it's 25 mg and it is given once daily, and then you titrate. Then you titrate as you need. So needed. So adverse effects being there is presence of dry mouth, there can be constipation. So there can be dry mouth, there can be constipation, there can be presence of sedation, as well as there is presence of weight gain. Then we move on to the combination therapy. So combination therapy is where you combine the NRT. So NRT with another agent. So with another agent is what you do. And the example being you have the patch as well as the gum, or using the NRT in combination with the bupropion. So you combine with the bupropion as well as a varenicline. Next, what are the dosage? The dosage and the administration. The dosage and administration is follow specific guidelines for each medication. Now, what is the AE? That is the adverse effects. The adverse effects may vary based on the specific combination used. To learn and grow daily like this, please do subscribe.